Focus test. Basically, we applied downward force to check a possibility of a sprained glenohumeral joint.
Alright, so this is the range of motion test. So the first one he's gonna put his hands behind his head. That's external range of motion. And if there's any limitations on each side, then that's a sign of a potential injury. The next one is the internal range of motion, which is like this. And if there's any differences on each side, then that's another sign of an injury. Alright, so this is the empty can test. I'm gonna have him put his arms like this. Well, I push down and he lifts up. And if there's any weakness, that's a sign of weakness in the supraspinatus. Alright, so this is the speech test. Now I have my arm right here and my hand over his wrist while I push down and he lifts up. And if he's unable to lift up, then that's a sign of tenosynovitis.
After the compression test, you're gonna have your patient prone. You're gonna bend his knee 90-degree angle. And then you're gonna apply compression to the meniscus while simultaneously applying external and internal rotation.
So this is the Hawkins-Kennedy test. And I'm gonna have him put my arm under his elbow and my hand on top of his wrist. And I'm gonna push down.
Okay, so for the patellar grind test, you're gonna apply inferior force to the superior portion of the patella.
Ow.
Alright, so this is the drop arm test. So Alan is gonna lift his arms up like this, like if he's flying. And slowly he's gonna bring his arms down in a controlled manner. And if he can't control it, then that means he has an injury to the rotator cuff.
Today we are doing the valgus stress test. So you're gonna have your patient lie supine. You're gonna pick up his leg, and then with your left arm, you're gonna push medially while pulling laterally with your right arm, like that. So we're doing the various stress test today. So you're gonna have your patient lie supine again, pick up his leg, and with your right arm, you're gonna push laterally while pulling medially with your left arm. Hopefully nothing cracks. We're doing the posterior drawer test. So you're gonna have your patient lie supine again, and then you're gonna apply posterior force to the proximal end of the tibia. Hello? So today we are doing the anterior drawer test. So you're gonna have your patient lie supine, and then you're gonna apply anterior force to the proximal end of the tibia.
Ow.
As such.
Alright, so next test is the AC sprain test. Basically what we do is apply downward distraction to the humerus to assist possible sprain to the AC joint. Tension test, so what we do is we add abduction and external rotation to the shoulder to assess the joint's stability. Test. Basically what you do is you rotate the ankle to determine the stability of the ankle joint. This is the anterior drawer test for the ankle. Basically what we're doing is applying anterior force to the heel to assist stability to the ankle joint. This next test is the Thompson test. Basically what we do is apply compression to the calf muscle to assess stability to the Achilles tendon. And if there's no movement, there's little to no movement, that means he possibly has a ruptured Achilles tendon. But if he does move, that means there's no injury.